Hello, my name is Max Christopeit and I work at the University Hospital in Tübingen in Germany in the Department for Hematology and Oncology and Stem Cell Transplantation. Today, it is my pleasure to present data circling the question when it is safe to transplant patients with an allogeneic stem cell graft after having survived COVID-19. In brief, the answer is as late as possible. But of course, we cannot delay curative treatment of patients with pressing diseases forever. It takes thorough experience to balance risks and benefits, as always, actually. We know that cancer patients can be hit particularly hard by viral respiratory illnesses, especially by influenza, but also by respiratory syncytial viruses and others. And lately, SARS-CoV-2 leading to COVID-19. The Infectious Diseases Working Party of the EBMT has shown that for patients with invasive pulmonary aspergillosis, fungal disease, receiving an allogeneic transplant, prognosis is not significantly worse when compared to patients without invasive pulmonary aspergillosis. In hindsight, I'd say their prognosis does deteriorate without a proper immune system. Here in this slide, Dr. Rüthrich and colleagues from the Jena group showed that overall survival of cancer patients with COVID-19 is worse than that of COVID-19 patients without cancer. They used data from the German collaborative working group LEOSS, but you can also see that these cancer patients do profit from intensive care unit treatment, at least to the same degree than their non-cancer fellows. On the side, that is one of the lessons we were luckily able to learn in recent years, how and when to treat patients with cancer on an intensive care unit. In the next slide, I can show you the knowledge that immunosuppressed patients can spread the virus for an extended time. Those two panels shown in this slide, on the right, including data from an own publication, show that culture of the virus, that is infection of target cells in cell culture, is possible for up to 2 months after first detection of the virus. Our patients who contracted COVID-19 shed the virus for an extended period of time too. This poses the additional task to keep fellow patients and medical staff out of risk when organizing care for this vulnerable population infected with COVID-19. During my time in the University Hospital Department of Stem Cell Transplantation in Hamburg, we were charged with the task to transplant 7 patients after having survived COVID-19. As you can see in this publication, patients presented with high-risk neoplasia. Additionally, they had severe or critical illness courses regarding COVID-19. And the transplant setting that we had to choose was a rather tough one, with a high degree of myeloablative conditioning and donors other than matched sibling donors, including 4 patients who underwent allogeneic transplantation from a haploidentical donor. Leukocyte and platelet engraftment occurred timely. Complications were in the range of what one would expect. Notably, no intensive care unit stay was necessary. None of the patients succumbed to treatment-related complications during the inpatient stay. With a fair follow-up, I can conclude that it is safe to transplant patients who survived COVID-19 with a graft from an allogeneic donor even after intensive conditioning and in a high-risk transplant setting. We transplanted as briefly as 2 months post-COVID-19. At the time, which was mostly between the first and the second wave in Germany, we devised a particular unit with dedicated staff and rooms. That put an additional burden on our department, but turned out to be fruitful, as was the interaction with institutional and regional authorities. I thank you for your attention, and I hope that your experiences with treating patients with an allogeneic stem cell transplantation post-COVID-19 will be successful for your patients. Thank you.